So we talked about using unstructured data sets and unsupervised learning to have insights naturally arise from that data so that we can naturally see what structure is there. Now we're going to talk about applying prediction to healthcare data sets. Now this is something you tend to do in more advanced staging of your analysis. This will generally follow unsupervised learning because you first want to do that exploration. But at the end of the day, you usually want to be able to draw a specific conclusion. So while it can be nice to have general insights from your data, you also need answers to questions like which of these patients are most likely to need surgery, or how many cases of flu vaccine should I order? Especially predictions about the future are very useful in healthcare, as in many other sectors. So why do you want to predict? Well, some people say you shouldn't, right? Yogi Berra said never make predictions, especially about the future. And the reason he said that is you're often going to be wrong, and there's only so much you can know about the future. So that continues to be true in healthcare and in any sort of prediction. But we still want to do it even if we're going to be wrong sometimes, and even if we're going to embarrass ourselves sometimes, because overall it's a very valuable exercise. It can teach you a lot about how things work, and it can help you prepare. So here are a handful of ways predictions are useful. Resource allocation related to both seasonal and cataclysmic health events, right? So medical researchers spend a lot of time trying to figure out how many people will get the flu every year. And similarly, medical researchers and government officials alike spend a lot of time thinking, if we want to prepare for cataclysmic health events, how should we do it? And that's where prediction comes in. So this is also very helpful for helping individuals prepare for long-term healthcare outcomes. So if you can tell someone based on their genomics, or based on their life profile, or just based on their demographics, like you are a white female in her 30s living in an urban area, so these are the 5 things that are most likely to happen to you that would threaten your health. That's very valuable information because people can be proactive in combating these things, and also so they can just mentally prepare themselves and have some idea of the trajectory of their health. Finally, prediction models can actually provide insights into causality. Now, causality is a very tricky subject, but when you can make predictions, or when you can show that certain variables are predictive of others, that is one argument for causality. What should you try to predict? Well, you can make predictions both at the individual and at the population level. At the individual level, there are certain kinds of things we can predict, such as the future value of a clinical value given previous clinical measures. So for example, with diabetics, you might be able to tell them, I'm seeing this blood sugar level now, and I have this record for the last 24 hours, and maybe you can predict for an hour out. And for people with diabetes, that's very useful because if they can know in advance that they are heading towards a low sugar moment or a high sugar moment, they can either try to prevent that, or if it's not preventable, they can at least prepare themselves and be in a safer place for that to happen. Similarly, we can predict an individual's likelihood of developing a condition or achieving a particular diagnosis. And this is where our prediction is not going to be a number, say like 144 milligrams per deciliter, but this will be a probability. So we can tell them the likelihood that your particular kind of cancer will metastasize is 57%. And that can also be really helpful for people individually, and also at the aggregate level, because then healthcare companies or health insurance companies can have an idea of what their expenses will be. So this brings us to the population level. What would we want to predict? Just like for an individual we can predict risk, we can also predict risk for populations, and we can do that either by predicting at the individual level and aggregating, or by breaking people into bins, right, such as demographic bins or genomic bins, and predicting outcomes for each of those groups. And in aggregate, those models will be true and can help with things like resource allocation. And so for aggregate resource use, we can also use the likely health outcomes of populations or subpopulations over time to figure out where we should spend money or where we should have equipment, etc. Common techniques to make predictions. Linear regressions and variations on linear regressions have been the workhorse of predicting the future for decades, and for good reason. These are not such sexy or cutting-edge techniques, although there have been many recent advances in how to fit particularly wide data sets. But what's important, even if they don't feel quite as exciting, say, as neural nets, is that they mirror how the world works. So many physical and sociological processes are linear, right? That might not be super exciting to think about, but the fact is many things are linear. If you get more of a dose of medicine, to some extent that's linear. It will be more or less effective. And so if the underlying systems are linear, our methodologies should be linear. These techniques also are advantageous because they have intuitive and clear methodologies with well-established statistical measures of efficacy and correctness. So that means when you use a linear way of making a prediction about the future, you know what your uncertainty is, and you are also able to convey this in a very intuitive way, versus models that are built with deep learning, for example, are not always quite so intuitive. So a linear method for predicting the future is generally your first best pass at predicting your data.